Back on the Rob Dibble Show with Ben Darnell. Our virtual takeover from Hartford Healthcare continues. And on the Bobby V Sports Tech Hotline is Dr. Tom Mcdonald, Hartford Healthcare Orthopedic Surgeon. And Dr. Mcdonald, how are you?
Hey, we're great. Thanks for having me, Rob.
All right, Doc, let me ask you about Tony Pollard. It just came out as we were coming back from break. He does not need surgery on his fractured fibula. Can you describe both cases, especially in an adult that has a fracture? Because is it a little different with kids, or am I wrong about that?
Yeah, no, absolutely. You know, every fracture has a certain personality to it, and the fibula fracture is a common one that we see in these kind of high-energy rotational injuries like the one Tony had. It's the small bone on the outside of the ankle, a long, thin bone, and it can be broken at different levels. And so a lot of times in orthopedics, whether or not that needs to be fixed depends on where the fibula is broken. If it's up higher in the leg, a lot of times biology will heal that, and it won't need kind of the traditional orthopedic plate and screw fixation.
Here's a dumb question. Will he be as fast as he once was?
Not a bad question.
Oh, I don't think that's a dumb question. I think that's on everyone's minds, certainly in that type of athletic arena. And the answer is that athletes, especially high-level athletes, can absolutely get back to that level of performance. He'll be getting top-notch care, obviously, and a ton of physical therapy and rehab, which will be a huge part in determining that answer.
In a high ankle sprain, is there any damage to the ligaments and the things around that area that possibly, I mean, you know, looking at, Pollard versus Patrick Mahomes, what are the decisions that they're doing with Patrick Mahomes right now?
Yeah, and I can't speak, directly to Mahomes' care, but that very common ligament pattern of injury known as a high ankle sprain, one that we hear about a lot. That's a severe injury to a whole complex of soft tissues around the ankle. So there's 9 ligaments in the ankle, Rob, and when we talk about a high ankle sprain, we're talking about injuring, up to 5 of those important stabilizing structures in our ankles. So a lot of the treatment and the variations in treatment that we hear about and read about will depend on what degree of explosion has happened to that soft tissue, how many of those ligaments are torn or ruptured.
And the more, my question for you is because I've had shin splints and sprained ankles and stuff like that even when I was playing, and I used to ultimately ended up wrapping my ankles even before I would pitch. In his case, you were talking about mobility. How can you wrap? Is it more difficult? I guess my question is it more difficult to wrap or mobilize a high ankle sprain as opposed to a regular ankle sprain?
Yeah, Rob, that injury, the high versus the kind of the regular, quote, low ankle sprain has a bad reputation for needing longer to heal. Oftentimes, these high ankle sprains, especially in high-level athletes, will require surgery to speed up the rehab and to kind of maximize the chance that that ankle heals with as much motion and mobility as possible. Stiffness after these kinds of injuries is a recognized threat, and your question around taping it and bracing it, that's a huge part of the recovery process. Many times these athletes will continue to tape, brace, or kind of externally stabilize their joint as they return to play for up to a year after the injury.
Well, we got a Patrick Mahomes that's coming out after about 6 days, Doc, and a little short than what your year determination just was. But for this guy, what are some of the points in his game that's going to be painful? Where's?
Yeah.
I mean, obviously not throwing the football unless we're talking about his plant leg. I mean, maybe you got some input there, but also, besides the regular running, when you're a quarterback, what are some of those motions, those movements that are going to be really painful for Patrick on Sunday?
Yeah, those ligaments, they really serve to stabilize against the rotational force. So when you plant your foot and kind of throw across your body, or as you cut, pivot, shift, moving laterally, that's where those high ankle syndesmotic ligaments really come into play. So as you're recovering from an injury to those ligaments, most athletes or most non-superhumans, I should say, other than Mahomes, would feel pain or hesitation or a hesitancy to really engage with a rotational movement if they're dealing with a high ankle sprain. So, your point's a good one. He is exceeding most expectations as he returns, and how well he deals with that in a high-impact, high-rotational setting will be determined.
Fascinated by this next one. Dr. Tom Mcdonald joins us, orthopedic surgeon from Hartford Healthcare Bone and Joint Institute. Trevor Story, shortstop, middle infielder for the Boston Red Sox, having an internal brace put around the area of his ulnar collateral ligament. Can you describe the operation for our listeners? I've looked it up and watched it. It's incredible, but even talk about the surgical tape and all the other stuff that they're putting inside this guy's elbow.
Yeah, to be clear, I'm a foot and ankle subspecialist, Rob, so as you ask me to comment on the elbow on the radio, I'd be more comfortable doing that over a beer. But, in broad spectrum, that internal brace is a device that we use in orthopedic surgery across subspecialties. We use it in the ankle to treat high ankle sprains. It's a device, analogous to maybe wearing a belt and suspenders in a surgical repair. It adds a little extra reinforcement to the soft tissue that you're trying to repair, the ligament structure. So it's a tool that we use to add a little extra stability to a ligament repair, be it at the ankle or the elbow. And the thought process there is that it allows physical therapy and rehab to maybe accelerate at a faster pace because you're relying on that extra internal suspension device to kind of shield your repair, maybe get the joint moving more quickly.
That's what we're thinking, because he's trying to avoid Tommy John surgery, which is possibly a full 12 months, maybe even 18 months.
But you're still drilling holes, correct? Even the ankle. I mean, are you still drilling holes to keep it set?
That's exactly right. Yeah, these devices, a little difficult to describe. A picture's worth 1,000 words, but they typically have two metallic implants or points of connection, and then in between those two pieces is this tightly woven polyethylene kind of military-grade suture, if you will. So you're implanting a part on either end and then using that internal suture or brace, we call it, to kind of act as a cable, a tightening cable or a suspensory cable to support the two structures that you're fixing.
Can you tear it? Can you tear that structure?
I've tried, Rob. It's really tough. I think every orthopedic surgeon takes that as a challenge, on the back
wow.
to kind of see how strong it is, and it's as I said, military grade, high tensile material. The science in orthopedic surgery as we evolve and use these implants to kind of aid biology and its healing is always fascinating to me and really impressive. It's certainly come a long way over the last 20 to 30 years.
Yeah, this story fascinated us, and yep. I'm still kind of amazed by it, and that Trevor's story fits this bill. I mean, everything that you just said and what he's going through, particularly being a Major League Baseball player needing to be ready as soon as possible. He fits the bill for this surgery. What about in your world where you say you do this for the ankle? Who qualifies for this kind of surgery?
Well, I think any human being with a high energy injury like this, always has a desire, to either get back to school or get back to work or get back to their team. And so a lot of these principles that make the headlines with high-impact athletes are also being realized, day by day in the community orthopedic office. Certainly at the Bone and Joint Institute, we meet a lot of occupational athletes, right? People just trying to get back to their day-to-day work or their week-to-week grind, and, they have a one-off injury. Maybe they slip and fall on the ice or at the mailbox. It's not always as high profile as some of the injuries that you've described, but it's a common thing that happens. And so a lot of my specialty and the science of the bone and joint is involved in applying this technology to kind of the average Joe and the real-world person. So we see a lot of these injuries.
Is it, and I don't want to get too deep in this, but it's fascinating to me and Ben as well, but like the Liz Frank injuries and the foot injuries and stuff,
Sure.
is there more technology coming that is going to protect athletes once they injure something and you try to fix? Because it's kind of like Albert Pujols. His fasciitis, his plantar fasciitis kind of lasted forever. And, on some of these, modern day athletes, as opposed to me being retired for the last 30 years, it's just, I'm jealous. I really am.
Right.
I mean,
Yeah.
you offer people quicker remedies to get back out on the field. Can you explain even the last 10 years?
Yeah, I think that the science of orthopedics is evolving and improving. The science of implant technology, and on the other hand, Rob, the science of biology is pretty static, right? Our bodies heal ligaments and tendons and bone in the same way that it has for a long, long time, and the two are always kind of competing for the same timeline, And so I tell athletes all the time, this surgery, this procedure, this technology, this implant, we think can accelerate your early recovery, your early motion, and I think that's where athletes these days maybe see a lot of benefit clinically from these technological improvements, where we're able to get the joints moving earlier, as opposed to maybe some time ago just keeping people in a cast for 8 weeks or 12 weeks. It's kind of an older school approach to some of these recovery protocols. So maximizing early stability in the operating room can get athletes moving with guided therapy, getting the joints in motion more quickly than in the past. And I think that plays out to some extent, but you still have kind of 3 months of biologic healing and 6 months of recovery for a lot of these orthopedic injuries.
How much does your protocol, like just as much as you're saying on the medical side and the technology side, things have really progressed, but also on the human side, bigger, faster, stronger, sir? I mean, we have got some monsters in football, monsters in baseball, monsters in basketball these days. And some of these monsters can't stay on the court. My friend Zion Williamson, man, every time I see a Zion injury report, I get upset. Anthony Davis down again with another stress foot fracture. What about these big guys? How much does your world change from dealing with someone who's 6 foot to 6'1" to 7 foot? And when you're talking about surgery, when you're talking about rehab, how many more factors kind of change with the size?
Yeah, I think we see that play out in all manner of ways in the sports world when we talk about head injuries and high impact, and how much can the science of helmet safety and protective gear shield athletes who are just coming with so much mass, size, speed, and quickness.
But even then, Doc, I'm not even talking about contact. I'm talking about the size and force that you're putting on your own body, your own feet, your own knees, your own ankles.
Absolutely, yeah. The cartilage is the cartilage, and it's still doing its job. At 100 pounds or 300 pounds, right? Watching some of these replay injuries of seeing these big athletes come down at just the wrong angle with just the wrong amount of torque, and watching replay after replay of these high ankle sprains it still gives me the willies, even as an orthopedic foot and ankle surgeon. It's hard to watch from the sideline. I think these bigger, stronger athletes produce more anxiety if you're a sideline doc, watching these pileups happen. It's enough to make me want to sit down and turn my head away.
Dr. Tom Mcdonald, Hartford Healthcare Bone and Joint Institute Orthopedic Surgeon. All right, so we're into winter sports, and you got a lot of snowboarders out there, skiers, having some ankle and foot injuries. Is there any kind of exercises and things people can do before they jump out on the ski slopes and stuff like that, snowboarding and stuff, to get ready for it? I mean, even stretching.
Yeah, I think stretching is always our go-to recommendation for athletes, especially us older breed of athletes.
Absolutely, I was thinking about us, Doc.
Reclaim a little youth and have some fun. It does make a difference. But to your point, snow and ski and snowboard injuries are really common with the foot and the ankle. We see a lot of these rotational. It kind of just didn't quite stick the landing mechanisms, and in that mode, the boot and the gear that we have, the flexibility of the boards and the equipment that we use these days, does protect the ligaments to some extent. A lot of times in those types of injuries. In the winter season, we're seeing more bony injuries, more broken tibia, that kind of thing, because the gear is so protective to the soft tissue and ligaments around the ankle.
Well, if I'm afraid of these stress foot fractures, I'm afraid of these little minute injuries that, especially if I'm a big guy, if I'm an offensive lineman or a basketball player, that's going to keep me out for a long time. Is there a preventative foot exercise or foot stretch that that should be done from some of these bigger athletes? I know this is a dumb question too, and I'm sorry.
No, that's perfect. I spend a lot of my time as an orthopedic surgeon talking about calf stretching, and it's seemingly simple, common sense thing, and we learn about it and harp on it. Most of us don't do it, but it really makes a big difference. That our calf muscle, or gastrocnemius, as it attaches to our Achilles, it's really the root of all evil when it comes to being involved in these aches and pains and repetitive soft tissue stress injuries, plantar fasciitis, Achilles tendonitis, a lot of the things that really weigh people down during the season or off season can be alleviated by calf stretching. So that's a huge part of what myself and physical therapy focuses on for these chronic soft tissue injuries.
No, I just saw Christian McCaffrey stretching out the calf during the Cowboy game, and I was like, oh, come on, seize up. Get a spasm in there.
Man.
No, he kept stretching it, and he heating it up, and he kept smoking the Cowboys. So, who are you rooting for this weekend, Doc?
I got a little piece of my heart on the Bengals, the Queen City Kitties.
Beautiful.
My college football coach is now the defensive assistant there, Mark Duffner. So I'll be pulling for the Stripes.
Awesome, beautiful. Man. My wife she's a big Joe Burrow fan. So
I love it. Yeah, he's hard to root against.
Absolutely. Thank you so much, Doc, for your time and your expertise. We appreciate it.
Thank you all. Take care.
All right, Dr. Tom Mcdonald, everybody, y'all go over there. If you got a bad ankle, bad foot, he's going to fix you right up. We'll take a quick break. We'll come back, do the sports menu, and then take you out to Coach Cav and Coach Gino Auriema's coaching shows following the show. We'll be right back.